Hi everybody, welcome to this webinar on the Encouraging Improvement theme of CQC's new strategy that we're currently consulting on. My name is Gillian Marsden and I manage CQC's research and evaluation function in CQC, and I'm one of the leads who have developed this improvement theme.
Hello, my name's Tansy Evans. I'm a strategy manager at CQC and I'm the other lead who has helped to develop the improvement theme of the CQC strategy. So as Gillian has said, today in this webinar we're going to talk through a little bit more about the strategy and the consultation we're running, and in particular look in more detail at that improvement theme. Why are we developing a new strategy and why now? We think our purpose, which is to make sure health and social care services provide people with safe and effective care, is more vital than ever, more relevant than ever, and that's not going to change. But we do want to adapt and develop the way in which we deliver that purpose. We know we're living in a time of very rapid change, particularly in health and social care. The COVID-19 pandemic has accelerated that change. And we're expecting that trend to continue. So therefore, we also want our regulation to change to meet these new challenges. We want to be more flexible so we can manage risk and uncertainty. We want to learn from our response from the pandemic. And we want to make our regulation more relevant to people and better able to deliver the best possible outcomes for people who use services. We know that it's not enough anymore to look at how one service works in isolation, which has been our model up to now. The way that people experience care is more in terms of a journey or a pathway. Collaboration within systems of care has become ever more important and is developing rapidly. And when we look at services, we need to be able to look at them through that system lens. So an important focus of our strategy is developing the way in which we look at systems of care as well as services and providers. The COVID-19 pandemic has also shown us, brought into focus inequalities in health and care across different areas of the country and different groups of people. And another key focus of the strategy is what we can do to address those inequalities and tackle them, working together with others in the health and social care system. So our strategy is built around 4 themes. As I say, this webinar is focused on the accelerating improvement theme. I'll just give a very quick summary of the other 3 themes that sit around it as well. The first one is people and communities. We want our work to be driven by people's experiences. We want to make much better use of the information we have about how people have experienced care. We want people to feel listened to. And we want the information that we give to be relevant to people and to reflect what they want to know and what's important to them. Smarter regulation. We want to be smarter in how we regulate, so that means keeping pace with how health and care is changing, regulating it in a more dynamic and flexible way to reflect changes. So that might mean moving away from set schedules of inspections to a more flexible, targeted approach, making better use of other sources of information, and particularly sort of use of digital, and being more flexible, responsive, and learning as we go. And safety through learning is the third theme. It's a key concern for us because it's consistently the poorest area of performance in our assessments. We want to promote learning cultures and strong safety cultures, ensuring that every service has people's safety as a top priority. We want to make sure that we are encouraging services to focus on protecting people and that we're helping them develop solutions so that all services have the support they need to make safety a priority. The fourth theme is accelerating improvement. I'm going to hand over to Gillian to talk about that in a bit more detail.
Thanks, Tansy. In terms of this, a core aspect of CQC's purpose has always been to encourage improvement. In our new strategy, we are planning to bring this to the fore to really accelerate improvement by doing more with what we know to drive improvements across individual services and systems of care. We want to do this because whether it's in an individual service or a local health and social care system that needs to improve, it's essential that improvement happens for the people who use and rely on them. And it's so important that improvement happens in the way that people can recognise. So that might be easier movement between services and pathways of care, in equal access to the most appropriate services at the right time, through reduced inequalities and a fewer avoidable mistakes, and ultimately better experiences and outcomes for people. However, we know that support that's available to help services improve the quality of their care varies between and within health and care sectors and across England. And some services have limited access to support. And within CQC, we think that we're in a unique position to help drive improvement. And so we'll use this position to focus on the priority areas that need to improve and help enable services and systems of care to access support where they need it most. We'll achieve this by collaborating with services, the people who use them, and our partners across health and social care. So within our ambition to accelerate improvement, there are several core strands, and these are how we collaborate with people who use services and other bodies within health and social care at a local and national level to drive improvement, how we can help to make sure improvements in health and social care happen, and how we can encourage new innovations in technology that will lead to better quality care for people receiving it. So what do we mean by these three areas? In terms of collaborating for improvement, we will establish and facilitate national sector-wide improvement coalitions with a wide range of partners across health and care, crucially involving representatives of people who use services. These coalitions will work collaboratively to improve the availability of support, focusing on the areas where there are gaps. This is both at a national level and a local system level. Within this, we won't be providing the support ourselves. Rather, we'll be championing others to provide consistent access to direct, tailored and hands-on support for those who need it. In addition to establishing improvement coalitions in individual sectors, we want to encourage our national partners to offer support to local systems to help them improve. We'll also strengthen our ongoing relationships at a local level to promote collaboration on improvement across areas. The aim will be to ensure all parts of the local system are focused on improvement, including addressing health inequalities. In terms of the second area of making improvement happen, we know that what was considered good a few years ago isn't good enough today, and what is good enough today won't be good enough in the near future. We'll therefore do more to make improvement happen by encouraging continuous improvements in quality. Part of this is about being clearer on the standards that we and people who use services expect. We'll set a higher bar for what we expect of services rated as good, including an expectation that services keep improving so they remain good, and expecting services to contribute to improvement in their local health and social care system as well. In addition, we'll identify and set improvement priorities, and then we'll take action to really shift the dial in these areas. We'll work with other partners on these priorities, and we'll share good practice, and we'll prompt action in these areas through events and workshops and by publishing guidance, tools and frameworks that can support improvement. Also, to make improvement happen, we will focus more on developing collaborative relationships with services that deliver health and care. This will be about helping them to find their own route to improvement by pointing them to sources of guidance and best practice and other providers and other organisations who can offer advice and support. This will be about holding improvement conversations with services to support them to decide on the best way to improve. It won't be about telling them what to do. It'll also be about empowering providers and local systems to improve themselves by offering analysis and benchmarking data so that they can use this to target improvements. The final area we want to focus on is encouraging innovation and technology. We'll make sure we understand changes being developed to the way services deliver care and work with health and social care services and other stakeholders to understand how these can improve the quality of people's care. We'll work in partnership with services and other stakeholders to develop a coordinated, effective and proportionate approach to regulating new innovations and technology. And we'll encourage and champion innovations and technology-enabled services where they benefit people and where the innovation results in more efficient and effective services by providing clear guidance and advice to help with innovation. All of our work to accelerate improvement will be based on evidence about what really works. So we'll be using research and evidence to have a better understanding of the conditions that drive quality improvement, including evidence best practice from other industries where relevant. We will use the best available evidence also to inform our approach to regulation, and we'll further develop and embed a culture of learning in CQC to maximise our impact on the quality of care and people's outcomes.
So underpinning the theme of accelerating improvement and underpinning all of the themes in our strategy, there are two core ambitions. The first of these is around health and care systems. As I mentioned in the introduction, we know it's more important than ever for health and care services to work together. And the way that people experience care is often not as a single service, but as a pathway or a journey. And we need to be able to reflect that in our regulation. It's not enough just to look at one service in isolation, because often the biggest impact on people's outcomes and the thing that really defines people's experiences of care is how services work together. So we want to adapt to this. Building on work we've already done, our assessments of people's care will now look across care pathways or the journey that people take through the health and social care system. We'll still be looking at individual services, but also looking across services and providers to see how well they work together, where there are gaps or where collaboration could be stronger. Our second core ambition is around reducing inequalities. We want everyone to have access to safer and better quality care. And we want to do our part to understand why there's such variation, both between different areas of the country and different groups of people. And through the data and intelligence that we gather, we think we can build on alongside others to gain a better understanding of that. Inequalities in care have been particularly highlighted by the COVID-19 pandemic, and we want to use the learning from this to help us drive change, working with partners and others in the health and care system. So we would really want to hear from as many people as possible about what you think of the proposals in our strategy. You can visit this link and respond through an online form. You can also view the full strategy document, read a bit more about what we've been talking about and also about the other themes that we haven't covered in so much detail today. There's also information about other ways to respond if you're not able to use the online form as well. Please respond by 5 p.m. on the 4th of March 2021. We really value everybody's contributions and thoughts. We've done a lot of engagement up to this point, and all of our proposals are built on what we've heard from our stakeholders, but we still think there's potentially room to develop things further, and we'd really like to hear what you think. Thank you.